I started working here, I believe it was going into undergrad in 2017, kind of back in the kennel. And so got to meet a lot of long-term clients then, and now getting to see them as doctors, pretty cool. But just that summer that I was here working the kennel was like, this is what I really want to do. And kind of coming back here is really nice because I love Lake County. I love the, Mount Dora, Eustis, Tavares, kind of Tri-City area, if you will. So it's really nice to kind of be back where I grew up, get to practice medicine and do a lot of different things back in home, which is really, really fun. And you get to do a little bit of everything because we get to do skin, hearts, lungs, teeth. We get to do it all here, so which is really, really fun. I really, really like probably surgery. It's probably my favorite. If I were to pick one thing to do every single day, I'd probably be back there operating most of the time. But having a break and be able to talk to people every now and again in the rooms and seeing patients is always really fun too. So that's the nice part about what we can do is I get to do all of it. I think the biggest thing, the newest thing we've been doing is how we manage newly diagnosed diabetics or hard to manage diabetics, whether it's cats or dogs, in terms of what insulins we use, how we monitor them. Kind of the old way was just blood glucose curves where patients we dropped off during the day and they'd stay here all day and we check their blood glucose every hour, 2 hours or so. Now it's the way we do it is a little bit, pets are at home, we have 2 weeks of data. It's a lot more individualized to each patient and things a little more stress-free for the animals. And the insulins are different too. So even shout out University of Florida's diabetes department for really kind of helping guide us in that way. But I think diabetic management has really, really changed and been something we've definitely been using more of since I started here. So I pretty much manage most of our diabetics now, which is really fun. I think the biggest thing is having honest conversations with clients and having good expectations from the get-go so that when stuff gets more serious or stuff gets a little more scary for owners, they can trust you to do what's best for their pet. It's really exciting and to have somewhat of a word into what we're making and what it looks like and the stuff we want to offer has also been like really rewarding too, because knowing we had a plan for expanding after being in this location for the last 10 years was really exciting, and we can make what we want to make out of it too, which is I think one thing that was really attractive, and I think pet owners, pets are really going to look forward to too. For me, I always love when I'm out walking around and people will recognize me because I help take care of their pets. What we do is really, really important for these families. And so that's the biggest thing is being able to help the sick ones and seeing them healthy again at an annual, down the road is always really fulfilling and makes you feel good on the side. So I run all the time. I actually coach a soccer team up in Lady Lake too during the week. So soccer, I'm running, pickleball. I get just a little bit competitive. I get that from mom, of course. Really anything outside. I think it'd be a teacher. It would be what I would probably do. I'd probably teach, so I'd probably coach soccer, but I'm also fluent in Spanish, so I maybe would travel abroad and teach English to Spanish-speaking countries and whatnot, but definitely a teacher of some sort. I have a dog. Her name's Cora. She's a little lab mix, and she's insane, crazy, and she loves to go to mom's house, of course, and terrorize them a little bit every now and again. When I was at University of Florida, I was on my ER rotation, and I was the 6 a.m. to p.m. shift, so it was a day shift, and she came in overnight, and she actually had a little bit of trauma to her eye where it didn't really exist anymore, and so she came in, and I was a student on her case, and I ended up taking her home about a week later. She's been with me since she was 13 weeks old.